Hello. Welcome to Thursday Lives with Whitman-Walker. Come on in, come on in. Good morning. So guys, I do lives on Thursdays with Whitman-Walker. So today is Thursday, so we are going on. Come on in, come on in. Hope everybody's having a great day. How's everyone doing today? Happy today. I'm glad to hear. I love happy days. Happy days are good. Happy days are definitely good. So just waiting to see a couple more people come on in. So come on in, come on in. We're going to get started in just a few. As you can tell, the heading, today's topic is about treatment as prevention. So if you're not sure what that means, stay tuned. So we give you guys some information today about treatment as prevention. You guys know I do lives with Whitman-Walker once a week, sometimes twice a week, just giving information to people who don't have access to information on, being careful, safe sex. Right now we're doing a lot of COVID talks. So thank you all for joining us. Like I said, today we are talking about treatment as prevention. For those of you that don't know, I've been a social media influencer with Whitman-Walker Health Clinic for about over a year, and we just come on here and talk, so people learn and people get information that they're not used to looking for, or didn't even know how to find information. So today we're talking about a new technology used to prevent HIV. So give me a second, guys. Whitman is here, so we are gonna get started. We have our guest. Good morning. Good morning. How, Brendan? How are you?
Good afternoon, Orlando.
Thank you for coming in. I wasn't sure. I was like, let me get started. We got this.
Yeah.
So, like I said, everybody, thank you for joining us. Today, we're talking about a new technology used to prevent HIV treatment. That's right. By treating HIV, we can prevent from new infection. It's called treatment as prevention. So abbreviated as TasP. You guys see that I posted it on top. TASP. Means that treating people who are living with HIV with effective medication can prevent transmission of HIV to their sexual partners. So if you're not sure, or if you need to get tested, get tested, because the sooner you know, the sooner you can get treatment. Once you get treatment and you are healthy, you can make sure you get tested and always are on top of your testing game. So before we dive in a little bit deeper, let's get you guys a little more information about what is HIV. So HIV is a human immunodeficiency virus, which is transmitted through the exchange of body fluids such as blood, semen, vaginal secretions, rectal, and breast milk. So fluids like tears and saliva do not carry HIV. Most HIV transmissions occur during anal sex. With men who have sex with men, but a number of people get HIV from vaginal sex as well. Injection, drug use, pregnancy, breastfeeding, childbirth. You can also prevent against acquiring HIV by using condoms, talking about PrEP or PEP, or using clean needles by choosing not to have sex, or injecting drugs by sharing needles or not having safe sex. So though there is no cure for HIV, we have a lot of tools to manage the virus. If left unmanaged, HIV can destroy your immune system, which leads to autoimmune deficiency syndrome, or it can become AIDS. So, which can lead to death. In the 80s and 90s, we didn't have many ways to manage HIV, and as a result, many people did die because of AIDS-related complications. But now we have solid care options. In fact, if someone with HIV takes their antiviral, they can live a normal, healthy life. So guys, for those of you who aren't really aware, HIV does come first. You cannot get AIDS from anyone. AIDS happens if you leave HIV untreated. So again, with the stigma and the you know, things that people say. Be super careful. Get informed. Get informed. You can't get AIDS from anyone. Like I said, AIDS is something that happens once HIV is not treated. So get tested. If you need to get treated, you can live years, healthy lives by being treated with HIV. So, if someone with HIV takes their medication every day as prescribed for long enough time, they will reach a point where they become undetectable. Undetectable, all that means is that if someone did have HIV test on that person, the test would show that they are negative. That's pretty wild. How can a test show that someone doesn't have HIV when they really do? Well, that's because the antiretroviral medication works so well at suppressing the virus in the body and decreasing the viral load that the test can't recognize the infection. So when somebody becomes undetectable, it's not only good for them and their health, but it's also good for their partner's health too. Someone who is undetectable cannot transmit HIV to other people. Again, because the viral load is so low, it just won't get past the lung. Hence the term U equals U. So anytime you see that U equals U, it means undetectable equals untransmittable. That means someone with HIV who is taking their medication as prescribed can't transmit HIV to someone else. So hence the term treatment as prevention. So by getting treated for HIV, the person is also preventing the spread of HIV because their undetectability means they can't transmit the virus. It's cool that U equals U works with every mode of HIV transmission. That includes unprotected sex, sharing needles, pregnancy, and childbirth with breastfeeding. So come on in, guys. If you have any questions, please feel free to ask. Don't be shy. We're literally just giving you guys information on treatment as prevention. Let me see if anyone's asked anything real quick. Appreciate you all for spending your Thursday evening with me. Just giving you guys a little information. Hope everyone is doing well. No messages, no questions. Love it, love it. Don't be shy, guys. If you have any other questions or you want to ask something in private, please DM me or DM Whitman-Walker. They'll be able to get you information you need. So if you're uncomfortable asking in public, please ask in private. We're here for you. We see you. We're here for you. As an important part of undetectable is untransmittable framework is that it only works when the person with HIV is taking medication exactly as provided, as prescribed. So make sure they have the regular follow-ups with care, including regular viral load tests to ensure the viral load stays undetectable. It's not like once you become undetectable, you stay that way forever. If you stop taking your medication, you can become detectable again and have the capacity to spread HIV. That is why continued treatment is very important. So make sure you are getting tested. And if you do, normally when that happens, you talk to the doctor and they check you out a couple months to see how you're doing. Once they get you at a nice place, they'll schedule the visits a little bit longer. So it could be every month. And once they're seeing that you're comfortable, undetectable, they could schedule you every 6 months. So it really depends on how you are taking your medication and making sure that you're treating everything. So in case you don't believe me, I can point to large research studies with newer HIV medications have shown treatment indeed is prevention. These studies have been monitored thousands of couples in which one partner was positive and the other was negative. No HIV transmissions were observed when the HIV positive partner was virally suppressed. This means that if you keep your viral load undetectable, there is effectively no risk of transmitting HIV to someone you have vaginal, anal, or oral sex with. Now, TasP can be used alone or in conjunction with other prevention strategies. You should also talk about your HIV status with your sex partners and decide together which prevention methods you will or can use. If you have HIV and you are looking to get treatment so you can stay healthy and prevent spread of HIV, you can please contact Whitman-Walker Health to get connected to care at 202-797-4439. The number is in the comments. I pinned it right below. And there's also email if you want to get tested for COVID or for any STIs. Please take the email below. They're only doing appointments now just for restrictions and all that stuff. But don't be shy. Call, get tested, and if you're not sure about your HIV status and just want to get checked out, Whitman-Walker does offer free tests for HIV STIs at our locations. Liz location is in Northwest DC, and our MRC location in Southeast DC. You can make appointments by calling 202-797-4439. So again, the number is pinned. So let's see if we have any questions, guys. How we doing in the comments? Hope everyone's having a great Thursday. We appreciate you. And also, don't forget, COVID is still around. It is still a virus that can be spread when you're within 6 feet of a person. So definitely sex is definitely, can't have sex at 6 feet. So be super careful. Now everyone's getting vaccinated. So again, everything is happening at once. We're not sure how things are going to work, how things are going to go. So be super mindful that if you are around someone who's not vaccinated, you still want to be careful about being around, because you might be vaccinated and you might be safe and dandy, but we're not sure how it reacts if you do come in contact. If you're in a place that's really packed, I mean, the best thing that can happen is you won't get sick. You can't get the flu, you can't get the cold if you wear a mask or you stay your distance and you make sure to wash your hands. Don't share beverages. We used to be used to all that. So as everything opens up, be super careful about germs. Wash your hands. Be super, super careful. I carry my wipes all over the place. My wipes, my hand sanitizer. So social distancing is still a way to reduce COVID transmissions. It increases the physical space between you to avoid spreading the illness, especially around these times that everything is opening up. You are going to see more people out in the streets. You are going to see more people in the restaurants. Clubs are opening up. Bars are opening up. People have been locked up for so long. So just be mindful. Be mindful that it's just not going away. All right. So get tested. Stay healthy. COVID is still out there, so be super careful. Stay 6 feet away from other people when possible. Wear your mask in public if you can. Avoid large crowds. Try to work from home. If you were able to work from home all this time, see if that's something that's possible to try to stay out of the office as much as you can. If you can't see someone who hasn't been vaccinated yet, FaceTime, talk to them over the phone. Also, if you know someone who's older, if you know someone who doesn't speak English, see if they have gotten vaccinated. Check with your family, check with your elders, check with your non-English speaking. Find out if they have registered for the vaccination. If not, help them. Because the sooner we get people vaccinated, if they're comfortable, of course, the sooner they can be around other people. So wash your hands for at least 20 seconds at a time. Stay home if you don't feel well. You can always contact Whitman-Walker on Facebook, Twitter, or Instagram at Whitman-Walker. And we also have our sister pages, the Real Talk DC _ to stay up to date with all things with Whitman-Walker. So thank you all. We appreciate you. We see you. If you have any questions, don't forget to please hit Whitman-Walker up in the DMs. They can get you information on getting tested for HIV, STIs. They can get you information on getting tested for COVID. They can get you information on getting vaccinated. So if you need help getting vaccinated, please contact us and we can see about getting you registered in your locality. So go to your state pages and make sure you are up to date with all the mandates that your state is giving. Things are opening up. I still want you to be careful. We appreciate you all. Thank you so much for coming in. Let's see if we have any questions. Cover up above and below. That's correct. Very, very true. Hello. No questions. So guys, if you're shy, don't forget to send us a message in the DMs at Whitman-Walker. And stay tuned. We will have more lives next week with all of our influencers. Brendan, thank you so much. Have a great weekend if I don't see you.
You
And
too. Bye.
everyone else, don't forget to be safe. Memorial Day weekend. Have fun. Stay outside. Enjoy the weather. Be super safe. We see you. We appreciate you. Have a great night.